A warm welcome to all dear students. In this lecture, we will discuss the pharmacotherapy of a common condition, cough, which we all have faced many times. Cough is a protective reflex. Its purpose being expulsion of respiratory secretion or foreign particles from the air passage. Mostly, it occurs due to stimulation of mechano or chemoreceptor in respiratory passage or stretch receptor in the lungs. Therapy, most of the time, the cause of the cough is viral and so doesn't need any specific treatment and may suppress in 4 to 5 days. But sometimes there is a specific cause for there is a specific cause that causes the cough, like bronchiectasis, bronchitis, asthma, or certain drugs. So finding out the specific cause and treating the root cause is the main aim here. And once the root cause is treated, the cough is suppressed. Sometimes if we don't find any specific cause for the cough, and the cough is causing distress to the patient, we need a symptomatic therapy. So broadly we can say cough may be productive and non-productive. Non-productive or dry cough or useless, and if it is causing distress to the patient, it must be suppressed. Productive cough serves to drain the airway. Its suppression is generally not desirable, and sometimes if suppressed, it even harmful, except if the amount of expectoration achieved is small compared to the effort of continuous coughing. So the main category of drug used in treatment of cough are antitussive agents, which are mostly used for dry cough, and mucokinetic agent, which are mainly used for productive cough. So come to the antitussive agent. Antitussive agents are the drugs which suppress the cough, and they may be peripherally acting or centrally acting. Peripherally acting means they decreases the irritation in respiratory passage. They may be local anesthetic or demulcent. Local anesthetic generally due to anesthetic property decreases the irritation, while demulcent have a soothing property on the respiratory mucosa and thus decreases the irritation. Centrally acting drug, generally they raises the threshold required to stimulate the cough center and thus suppress the cough. They include narcotics like codeine, full codeine, non-narcotic dextromethorphan or noscapine, and antihistamines, diphenhydramine, promethazine. So come to the drugs. First is local anesthetics, benzocaine or benzyl alcohol. They help in cough associated with the pharyngeal irritation. Lignocaine is used for cough associated with bronchoscopy, but routine use is not preferred since there is a risk of aspiration for many hours. Systemic complication like seizures and arrhythmia may occur. Then come to demulcent. They produce a soothing effect by coating the irritated pharyngeal mucosa and preventing its dryness by increasing salivary flow. Honey, glycerin, licorice are used for demulcent. Then narcotic antitussives. Narcotic group involves the morphine, hydromorphine, codeine, full codeine. We have all seen that the opioid group are very potent antitussive agent, but morphine, hydromorphine can't be used because they have a very high addictive properties. Opioid group also have a lot of side effects like vomiting, biliary colic, urethric spasm, constipation, bronchospasm, respiratory depression. If we use codeine in antitussive doses, if codeine is used at a dose of antitussive doses, It is relatively safe and have a less adverse effect. Then non-narcotics. These are antitussive with no significant analgesic or addictive effect. The drugs are dextromethorphan, noscapine. Dextromethorphan acts centrally and increases cough threshold. In high dose, it may suppress CNS. Noscapine, equipotent antitussive as codeine. It is a potent releaser of histamine and may cause bronchospasm. Then antihistamines like diphenhydramine, promethazine, sedative and peripheral antihistaminic anticholinergic activity mainly play an important role here. Then come to mucokinetics. Mucokinetic agents are those agents which promote the clearance of respiratory tract secretion and thereby improves the effectiveness of an ineffective. They may be mucokinetic agent, may be bronchial secretion enhancer, or we can say expectorant or mucolytics. Expectorant, these are the drugs which increases bronchial secretion or reduces its viscosity, thus facilitates its removal by coughing. They are believed to loosen the cough, which become less tiring and more productive. Vaguely mediated expectorant. They may be vaguely mediated expectorant like guaifenesin, epicucuana, terpene, hydrate, ammonium chloride. They irritate gastric mucosa, leading to reflex stimulation of bronchial gland by vagus nerve. Thus, the bronchial secretion is increased and easily can be removed. Then iodine, it acts directly or indirectly by stimulation of respiratory tract secretion. It also increases ciliary beating and decreases viscosity of mucus. There may be problem of hypersensitivity and iodism. Prolonged use may suppress thyroid. Then come to fluids. Maintenance of adequate hydration is an effective measure. Aerosolization of water vapor has a demolition effect, decreases the viscosity in the upper airway. Tincture benzoin, menthol, or eucalyptus, which are volatile oil, can be added to provide a soothing effect to the mucous membrane. Remember, it is the most cheapest therapy which we can use in cough. Mucolytics, they alter the physiochemical property of respiratory tract mucus and decreases its viscosity. As the name suggests, mucolytic, they causes lysis of something. So these drugs, they alter the physiochemical property of the mucus and decreases its viscosity. The drugs are acetylcysteine. It splits disulfide bonds between the mucus glycoprotein and thus produce less viscous mucus. It also inhibits antibacterial effect of antibiotics like erythromycin and ampicillin. Other are bromhexine and ambroxol. It depolymerizes mucopolysaccharides directly as well as by liberating lysosomal enzymes. It also has a property like it increases the volume and decreases viscosity by direct and indirect increase in secretion. It increases ciliary beating, and ambroxol is an active metabolite of bromhexine. Enzymes trypsin and chymotrypsin. They decreases viscosity by digesting sputum protein. They do not digest living tissue since both serum and viable cells contain specific inhibitor. They are less effective in purulent sputum since they are inhibited by DNA. deoxyribonuclease, that is pancreatic dornase, degrades DNA. So liquefy purulent sputum. So they are effective in purulent sputum also. It is used in aerosol form in some conditions like cystic fibrosis and atelectasis. So that's all about the pharmacotherapy of cough. Thank you.